Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Dwi Pitri Wulansari and I'm a second year dental maxillofacial radiology resident in Pajajaran University, Indonesia, and also a permanent staff in Hasanuddin University. In this occasion, I would like to present a case report entitled Cone Beam Computed Tomography Findings on Temporomandibular Joint Osteoarthritis. A 26-year-old woman came with a referral from the prosthodontic department for an open and closed TMJ CBCT examination. The clinical diagnosis was disc displacement with reduction. The patient had a complaint of pain and clicking sound when chewing since 11 months ago, and from extraoral inspection we found an asymmetrical face to the right, and there is also clicking sound when the patient moves his jaw to open and close position. In radiography examination, we do some steps before we decide a suspect of radio diagnosis. And in this case, we perform a CBCT examination on TMJ in open and closed condition. And after we receive the DICOM data, we extract it and we then perform editing on right and left TMJ, both in open and closed. And then the interpretation was carried out from the axial, sagittal, and coronal, and the analysis of the radiographs then continued to assess the shape of the condyle and the intercapsular space, and also to find any specific abnormalities. And in addition, an analysis of the capsular position was also carried out to ensure whether the condition of the disc was in accordance with the patient's referral story. And from the panorama view, we found some abnormalities of articular eminence and head of condyle. And also from the axial view, we can see that the position of the condyle was not symmetry between the right and the left. And from the coronal and sagittal view, we found that there was a thinning and discontinuity of a cortical on left condyle and right condyle. And then we found a pointed radio-opaque resembling a bird beak in anterior region of head condyle. And we also found well-defined radiolucent with corticated border on left condyle, and we suspect this radiolucent lesion as elysis. Based on the radiograph features, we finally suspect this case as disc displacement in association with osteoarthritis or degenerative joint disease. And this is the classification system for diagnosis temporomandibular disorder from Jeffrey Okeson. And we know that internal derangement consists of this displacement with or without reduction. And if any disc displacement that left untreated, it would become a degenerative joint disease. And this, in this case, is osteoarthritis. To assess the condition of the MG, we can use the diagram proposed by McDonald's. First, we need to assess the condyle, and in this case, condyle had abnormality in shape on its head of condyle as osteophyte. After that, we assess this skull base, and in this case, that glenoid fossa in normal condition, but the articular eminence suffer a flattening condition that lead to temporomandibular dysfunction. And the assessment of the joint we'll explain in the next slide. When we assess the joint, we can evaluate it whether the problem in space or about the movement of the TMJ. And in this case, the abnormality was about decrease of the size of the space. So we can conclude that this condition was degenerative disease. Okay, this is the radiograph feature of degenerative joint disease. And there's some signs of osteoarthritis that can assess from orthophant tomograph and also CBCT. And from all of these signs, a case could have at least three of these signs to be suspected as osteoarthritis. And from this case, we found osteophyte condition, subcortical cyst, and also surface erosion. That's why we conclude that the suspect of the diagnosis of this case was osteoarthritis of temporomandibular junction. And the difference between osteoarthritis and rheumatoid arthritis, the main point is coming from the TMJ involvement, is it symmetry or asymmetry, and also from the radiographic findings that in osteoarthritis there always be exophytic condition beside an erosive, but in rheumatoid arthritis it's only about erosive of the cortical or cartilage. Well, this is about the modality of choice. We can see that first, whether the TMJ is the primary site of the problem or no. If yes, so we could assess the asymmetry condition. And if we don't find any gross symmetry, then it concluded that it was some degenerative joint disease from the signs like subcortical cyst, surface erosion, and also osteophyte. So we can choose the MDCT or CBCT for the modality of choices. And the last is about the conclusion. Clinical examinations sometimes can provide a clear indication in the presence of the TMJ osteoarthritis. Therefore, the clinical examination will be strongly supported by imaging. In this case, the use of CBCT was evaluated the bone and hard tissue structure around the TMJ, especially in symptomatic form of osteoarthritis. I think that's all for my presentation today. Thank you for your attention. Stay safe everyone. Assalamualaikum warahmatullahi wabarakatuh.